Hi everyone, my name is Sara Camilleri. I'm a postdoc at Northwestern University, and today I'll be presenting a poster on electric heavy-duty vehicles and their implication on air quality and public health. Why are we interested in heavy-duty vehicles? So heavy-duty vehicles constitute 6% of on-road vehicles, and they contribute to CO2, NOx, which is a key precursor in ozone formation, as well as PM2.5. In addition, in the US, 43% of traffic-related PM2.5 and ozone mortality burden is linked to on-road diesel pollution, and NO2 also contributes to around 200,000 pediatric asthma cases annually. Heavy-duty vehicles are also related to disproportionately impact racial minorities, given that emissions related to heavy-duty vehicles typically happen where racial minorities live. Although the implications of heavy-duty vehicles and electrifying heavy-duty vehicles have been studied in terms of their emission impact, little is known on their implications on air quality, particularly at high-resolution scales needed for neighborhood studies. To simulate a 30% reduction electrification of heavy-duty vehicles, we not only scaled down vehicle miles traveled, as well as reducing 30% of on-road tailpipe refueling and extended idling emissions, but we also apply a novel emissions remapping algorithm whereby we shift those reductions in emissions and then represent the additional electricity needed at EGUs. Once we determine these changes in emissions, we apply these in a CTM at 1.3 kilometer resolution. In particular, we use the WRF CMAC modeling framework, which is two-way coupled. And then we ran a total of 4 simulations, one in August and October 2018, and one in January and April 2019, and then averaged them to get an annual total. The implications for emission changes, we can see here that we have large reductions in NOx concentrations, particularly in urban areas and along roadways. And we have marginalized increases in NOx concentrations, particularly at EGUs, where we have that additional electricity. And here we have the EGU locations by fuel type, and we can see that within our domain, we are mostly run with gas-powered electricity. Overall, we find net emission reductions, in particular for NOx, we find emission reductions of 7%, for CO 1%, and we also find CO2 emission reductions of around 2.7 million tons per year and around savings of 503 million per year. We note that for SO2 emissions, these are the only emissions that we see a net increase, and that's about 3%, typically occurring at coal emission EGUs. Moving on to the changes in air quality, we find overall reductions in NO2 concentrations and PM2.5 concentrations across the modeling domain. However, this does not hold for MDA2 ozone concentrations, and this is linked to the nonlinear relationship between NOx and ozone concentrations. We go a step further and identify if there are any additional days with levels of MDA2 ozone concentrations higher than 50 ppb, and we find around 2 to 6 additional days with levels that are higher than this limit. Using those changes in pollutants concentrations and predetermined CRFs from epidemiological studies, we determine the changes in attributable mortality related to NO2 and PM2.5, and we see overall reductions in the annual attributable mortality related to these two pollutants. However, for ozone, we see additional attributable deaths because of those increases in pollutant concentrations. In this estimation, we have to incorporate changes in the baseline mortality, so that also plays a role in determining which census tracts have the highest changes in attributable mortality. This is the last part of the study, which is some preliminary results, where here we try and identify those census tracts which have a high white community versus least white community. We determine that we have larger health benefits for racial minorities, that is census tracts that are representative of racial minorities, and also that these census tracts also exhibit the largest decreases in NO2 and PM2.5 concentrations. So overall, we know that shifting 30% of the day's heavy-duty vehicles to electric will result in net emission reductions, net reductions in PM2.5 and NO2 concentrations, but slight increases in MDA2 ozone. overall, we find health benefits, and we also note that we have reductions in environmental disparities and amelioration of health impacts for marginalized communities. Thank you for your listening.